Society, and they have an amazing kitten program. So today we're going to hear all about how the kitten program works here.
And I'm Lauren. I'm the Director of Medical Operations here at the Jacksonville Humane Society. We care for thousands of kittens every year in lots of different conditions. They come in healthy, they come in with Panleucopenia, ringworm, scabies, you name it. We'll do our best to try to take care of them.
All right, let's go take a look.
This is our Kitten Services lobby. This is where folks bring kittens if they're concerned for their welfare. We do our best to keep kittens out of the shelter because of the risks that poses. But if coming into the shelter is the best option for those individual kitties, this is where we perform the intake exam.
I love that you have this information here. And do you guys ask people to take them back with them?
So ideally they are searching for mom. If it is a neonatal kitten, likely mom is around, as we know. So we try to reunite with her. But if for some reason mom is not around, they've waited or whatnot, then we encourage them to care for those kittens on their own. We have resources for free veterinary care for them, food, litter, anything they need to be successful outside of the shelter we'll provide. But if they're unable to, again, we can do intake. They become in custody of the shelter, and then we do all the things here.
All right, let's go.
So once they have an A number, they come into the shelter. The counselors up front get an initial triage to make sure they're warm and generally doing okay. If they have concerns, we've got little stickers or ways to notify the techs of an urgent case. But for the most part, healthy kittens are going to come onto the counter and wait for a technician to do their exam.
And who names them? Because these are really cute names.
We have a QR code that the community and staff members can submit names. Or our Pet Help Center counselors get creative. They do all kind of crazy names and themes for our little guys. Once they're ready for their intake exam, the technicians will bring them into kind of a quieter space here where they will get their first vaccination if they're at least 4 weeks old. They'll get a dose of flea prevention, salamectin, and they get microchipped, an exam, make sure they're healthy. We offer a little bit of food if they're of age to eat on their own. Otherwise, we start with bottle feeding to make sure that these guys are getting a little bit of nutrition right from the get. If from intake kittens are eating well, doing okay, don't need close monitoring, they'll be housed in any of these kennels or our foster office where they will await a loving foster home. So this is where the kittens wait for their foster family to pick them up. Their photos actually get put live on our website as soon as we change their status to pending foster care. So anybody can go to www.jaxhumane.org/foster-needs to see who is here right now that needs foster care. Our goal is to get these guys out into foster homes. We do our best to house them here in a safe way. We disinfect kennels between inhabitants, doing our best to scrub the bars, disinfect, all those things. But anytime we're going to have an abundance of kittens living closely, they are at risk of disease exposure and spread. And so getting them out to foster homes, even if it's somebody new to kittens, is always going to be better than here. We just have to arm them with information and make sure that they are comfy. So sometimes that means, sending out our more tricky eaters with experienced folks versus new fosters, getting these guys who are chomping and doing great and don't have any medical concerns. And that really helps us retain those fosters if they have a good first experience. We're building those relationships with them. We're talking to them about, what litter is going to be a good fit, not just based on how they look. Sometimes people come in thinking they want this certain kitten because of, coat color or whatnot, but helping guide them to make the right choice that's going to be successful for them and those kittens. And we really try to decrease barriers. We don't have an application. We don't really put any sort of limits on who can foster. As long as they fill out the application and are here and willing to help, we will set them up for success with some kittens.
So cool. And look at you. You're just over here being a little biscuit factory. Listen to those purrs.
He's got a little catheter in.
Wow. The amount of medical that you guys do here is profound. I see so many kittens who clearly are receiving some kind of special medical
care?
Yeah, we have really incredible veterinarians that are well-versed in kittens and willing to learn new things and try new things. So that helps a lot too. Our technicians are given protocols from the veterinarian as far as, standard deworming whenever they come in. If they have a concern that's outside of those protocols, we do veterinary rounds 7 days a week. So that really a veterinarian is laying eyes, doing an exam, and coming up with a treatment plan, which has been a huge help too. So through these doors is our Kitten Counter. This is where our little guys, 4 weeks and younger, are more closely watched during the day here. They each get a timer, a feeding chart to make sure that we are monitoring them closely, getting them those feeds as timely as possible. We've got guides up here for anybody to jump in and mix formula and feed a kitten. Anybody can kind of gauge how much the kitten needs and how often they need fed, thanks to Kitten Lady feeding chart.
I see that. That makes me happy.
A lot of these guys are, of course, ones that cannot stay overnight in the shelter. And so we have a texting service that's actually used for teachers called Remind, where we can send a text message blast to anyone who signs up. And we can say, hey, we've got these litters who can't stay overnight. Who can help pick them up? And even if it's overnight for one night, it is very helpful because otherwise staff is taking them home again. But we love to get them out for a longer term foster if possible. But again, even overnight is super helpful.
I see 2 letters on this box that are of interest to me.
Yes,
An R and a W. Can you
So,
talk about that?
Yeah, we treat kittens for ringworm or suspected ringworm. That's something that is typically noticed at time of intake. We'll pull a fungal culture. Even if the Woods lamp is negative, we still want to pull that culture if they have clinical signs of the fungus. So we always wear gloves with every kitten. It's just kind of an extra precaution that we indicate that on the box. But these guys will go to foster just like anybody else. We'll notify the foster parent that, hey, we think this might be what's going on.
So here I see a Panleucopenia exposure.
That's right. So Cola was in the foster office earlier this week when we had 2 kittens test positive for Panleucopenia. And so we want to be monitoring Cola extra closely over the next 10 days during that incubation period where she might start to develop those clinical signs of Panleucopenia. So again, we kind of have her separate from the other boxes. We've got her on newspaper. We're extra precautious with this, highlighter indication, but she will be fed and monitored just like any other bottle baby on the counter here. And she is doing amazing. She's super lively. Staff have taken her home the last couple nights, but we think we can find her a foster who can watch her very closely too. She's very good and very cute.
Can you talk about finding fosters who will do these medical cases? What do you think is working well for you guys to make that possible?
Definitely. I think it's really important to be transparent about, hey, this kitten was in the room where we know this virus was. And so telling them what to look out for and to come on in if you're noticing any signs of decreased appetite, diarrhea, vomiting. We want to get ahead of it so that we can test and start treatment. But really that it doesn't have to be the scariest thing. And that honestly, in a foster home, they're going to be able to monitor even more closely than we do on this counter. Because things get busy and we have our timers and we're doing our absolute best, but nothing is better than being in a foster home. In our shelter, we take care of kittens with Panleucopenia. We recently had a few kittens test positive for Panleucopenia in our foster area. They are currently being housed in this isolation ward where they're undergoing treatment, monitored very closely for clinical signs and daily checks with our veterinarian. Anyone else in that foster ward that was potentially exposed to Panleucopenia is now being housed in this isolation ward. They're monitored every day, all day by our animal care and enrichment staff for clinical signs of Panleucopenia so that we can test and address those concerns and potentially move them over to the positive side if they do test positive. These are the kittens being treated for Panleucopenia. Anecdotally, about 60 to 70% of these kittens will make it out of this room alive.
That's amazing.
So upon testing positive, these kittens get an IV catheter placed so that we can start administering IV antibiotics, anti-nausea meds. They most commonly don't want to be eating. And so we give those meds intravenously. And then once they do start eating and feeling better, we can switch to oral medications. But really it's just supportive care until they can start feeling better. And then after day 7, we retest and bathe them out.
I really like all of the disposable enrichment.
Yes, definitely. We try to only do disposable, bedding and things in here. Anything that enters this room is trapped in here unless it can be cleaned with isolation strength rescue. Critical patient exams are done 3 times a day on these guys. That's just something we schedule in our medical record system, but it requires that the techs are going in to assess hydration, attitude. They get a rectal temperature on these guys and record all that in the EMR so that our doctors can, without having to physically go in here every day, get a good picture of how the patients are doing. Both rooms require full PPE. We do have bunny suits, double gloves, bouffant caps, shoe covers, if I didn't already say that. But full PPE when entering the room, clean exit. We don't leave any supplies in the room. They prep it outside of the room to be able to bring it in. That way we don't waste excessive litter and things like that. Thanks, guys. When folks see on our website a litter or an individual that they want to foster, this is where they come to make that happen. Our veterinary technicians work in the foster department, and they will supply our foster parents with information, food, litter, medications, all the information they could possibly need to be successful at fostering.
You have these stats like publicly posted here. Can you talk about kind of the motivation for doing that?
We want to make clear to our foster parents that we see so many kittens, that if there is a little bit of a wait for your appointment or pickup, just know that we are doing our darndest to be as quick and efficient, but that there is a high volume of kittens that we are caring for, whether it's answering emails about questions or trying to make sure we're feeding on time. Usually 2 staff members scheduled in foster each day. And then if it gets kind of hairy, we can pull from other areas. But for the most part, 2 people are manning the foster department 7 days a week.
355 kittens currently out in foster.
And that's low. This is like slower October, tail end of our kitten season. It's gotten up to 600-700 during our May, June kind of peak of Kitten Mountain.
Oh my goodness. I'm just so blown away by how successful your program is. Can you share what you think is working for your community? How do you get so much buy-in from your community?
Yeah, we've come a very long way. I think just putting it out there on our social media, word of mouth is really big, because someone had a great foster experience. Now they're going to tell all of their friends to come and pick up kittens. And so just making sure that you're not making it a scary thing, whether it's ringworm or Panleucopenia exposure, we really try to put in perspective that you can care for these kittens. Even if you've never done it before, we're going to give you the information, the supplies to do it well. And then when people do have problems or whatnot, we're here to support them and help them learn, how to do better next time.
You guys are absolutely amazing. And I can't say enough nice things about the work you're doing. Thank you.
Yeah.